My topic is health service use by people with CP across the lifespan, and I'm going to share some preliminary data from a single health network. And I'd like to acknowledge the National Centre for Healthy Ageing, who allowed me to access this data, which is through a collaboration between Monash University and Peninsula Health. So emerging research suggests that people with CP as they age may experience earlier mobility decline, develop pain and fatigue, may experience increased risk of non-communicable diseases such as high blood pressure or diabetes, and may also experience increased rates of mental health disorders. In addition to the lifespan healthcare needs for management of respiratory, tone, epilepsy, etc. Now, we all access various public health services which are available on a continuum from primary care, for example, GPs, through to emergency departments, acute hospital inpatients, outpatients, or even community health services. However, there's very little Australian data relating to health service use by adults with CP. So we know very little about why, how often, and which public health services that adults with CP access for their health needs. In this study, I was able to access AIHW data that described health services relating to an outer metropolitan health network, and that provided me with information about emergency department access, inpatient admissions, outpatient appointments, and community health appointments. And this data was retrieved for a 5-year period from January 2019 through to December 2023. And this data captured 499 individuals with a diagnosis of CP of all ages who received healthcare from this network on at least one occasion, and one of those health services were accessed, so emergency department, inpatient, outpatient, etc. And again, they may have accessed more than one of those services. Let's first have a look at emergency department access. There were more than 1,200 episodes of emergency department care that were reported in the data over the 5 years. The mean age of people with cerebral palsy who were accessing emergency department services was 42 years old, although as you can see, there were individuals who were children as well as individuals who were adults. Perhaps, as you can work out from the data above in bold, we can see that some people access the emergency department quite frequently, so more than 5 visits in 5 years, and that was 72 people. Interestingly, around about 30% of those visits were categorised as low urgency, which, when we're looking at the big picture of health services, it could suggest that care could have been provided in a primary care setting rather than the person having to go to the emergency department. So what sort of reasons were given for why people with cerebral palsy were fronting up the emergency department? And I do apologise, this is quite a busy slide, but hopefully you can navigate your way through it with me. So in the 3 columns of numbers, the first column, number is for the entire cohort, so from birth right through to older adults. The middle column there is for children, so up to the age of 17. And then the last column on the far right is information from adults with CP, so anyone 18 years or older. And essentially what we can first see is around about 30% of all ages, so not much difference at all between children and adults, were admitted with what was categorised in the data is a bit of a catch-all. So this description is symptoms, signs and abnormal clinical and laboratory findings. It's things like abdominal pain, chest pain, shortness of breath, nausea and vomiting, etc. And around 30% of visits were coded as that. Similarly, we can see quite similar percentages, not much difference in the age groups between people who presented with injury, poisoning, or other consequences of external causes. And these are sort of fractures, sprains or strains, head strikes, and also possibly complications of pegs or catheters. Similarly, diseases of the respiratory system, pneumonia, pneumonitis, again quite similar in the percentage of adults and children who were coming to the emergency department. Perhaps not surprisingly though, much more adults than children, proportion-wise, presented with constipation, pain and urinary tract infections. And again, what we know in children, that again, children are much more likely sent with gastro to an emergency department or for epilepsy with CP. As a good physio, I'm also very interested in the number of falls, and there were 83 falls in people with CP that were recorded. Let's now have a look at inpatient hospital admissions. Around about the same number, so around 1,300. Fair amount were admissions through the emergency department. Mean age slightly older, so 49. And again, I guess the big difference we can see here is that very few children were admitted. And the reason being is that, in fact, there is a specialist sort of children's hospital within half an hour of this emergency department. And so I suspect that children who were critically ill were in fact transferred across to this specialist children's hospital. And again, we can see an age gradation here with more admissions in older adults than younger adults. And again, that's what we see in everyone in the entire population, not just people with CP. Again, if we have a look now at what are the most common reasons, and apologies, I realise I forgot to put the percentages in here, but essentially we can see around about 15% or so of adults were admitted, again with sort of catch-all classification of abdominal pain, chest pain, nausea and vomiting, or with sprains and strains or problems with pegs or catheters. The next most common reasons were again attributed to epilepsy or seizures, pneumonia and constipation. And the other thing that I think is of interest, certainly to CP Achieve colleagues, and I'll be unpacking a little bit more in depth, is around about, I think maybe that's 4% or so, 5% of people with CP were admitted with mental and behavioural disorders. Now, I was also very interested not only in what reasons were they coming to the hospital for, but how were they journeying sort of through and between health services. So, you know, perhaps you can imagine that someone might have an acute issue where they present to the emergency department, they're admitted, go home, and then maybe they might have some outpatient follow-up or GP visits as a consequence. However, as I'm sure you're all much more aware, that a lot of people with CP do not have that very sort of linear trajectory through health services. And I just started trying to sort of track a couple of participants in the study, and this is a bit more like what their journey was. So certainly it is absolutely not linear. Again, I've got a couple of case examples just to show you some of those, again, people who are heavy or high users of health services. So this is Chris, who's in his sort of mid-50s. In the 5 years, he had 26 emergency department presentations. In 2 years, 21 of those within a single year, mainly due to egg complications or chest infections, but he also had a fall. Again, a large number of inpatient admissions due to pneumonitis or PEG complications, and multiple outpatient appointments with a dietitian to manage a modified diet. Gina is in her late 20s, again, heavy user of all services, emergency department, 8 emergency visits in a single year, lots of musculoskeletal injuries and consequences of that, 5 falls, and again, lots of inpatient admissions with musculo injuries, cellulitis, and in fact, on one occasion, she had to have an inpatient rehabilitation stay for an ankle fracture following a fall. And she then had obviously follow-up outpatient. So my next job is to try and track these individuals who are high users of health services to try and understand some of the reasons, consequences, and actions that are taken. So to conclude, some adults with CP are obviously very high users of public health services. The data that I presented today may be unique to the local geography. Unfortunately, it's not linked to the CP register, making it quite difficult to interpret as no CP characteristics are available. But I would hope through a better understanding of this, we can promote better health through improved primary care services, in particular looking at those sort of, low urgency admissions. What can we do better in the primary care space to perhaps identify early risk factors for adults with CP, for example, risk factors for respiratory disease or falls? Thank you.